I like this part about hidden surcharges. So that would be why when people say, oh, I went to the emergency room, that Tylenol cost, I don't know, I'm making something up. The Tylenol was $120.
Right.
I can buy the Tylenol over the counter.
That mucus containment system, the tissue, cost $200.
Mucus containments. Yes, right. Because they have to kind of embed these costs. Because I guess when you look at an itemized bill then, and it's been a long time since I've seen one, thank God, but there isn't one for administrative costs.
Right.
You're listening to Take on Healthcare with Ted Suzelis and Mary Sheehan. Ted is a naturopathic doctor who has been helping people in Northeast Ohio for over 20 years to live a happier and healthier life through natural healthcare, including dietary advice, vitamins, herbs, and other natural substances. Mary is a full-time pharmacist who also helps leaders in healthcare suffering with anxiety and depression integrate the best parts of traditional and alternative medicine. Did you ever wonder why your insurance premiums have increased? Or why your prescriptions are so expensive? On today's episode, Dr. Ted and Mary are breaking down U.S. healthcare and what it costs to keep the system running.
So I had a patient the other day pick up a prescription. It had a really big copay. He is an independent business owner, and he told me that in the past 2 years, his premiums have more than tripled for his family of 4. Like, I can't even believe what the number was so high that I've forgotten how much he was paying for his health care. So in today's podcast, we are going to take on the price of health, understanding U.S. healthcare costs. Why does it cost so much, Ted? We'll answer that. So according to a report by the Centers for Medicare and Medicaid Services, healthcare spending in the U.S. reached $3.8 trillion in 2019, or about $11,582 per person. That's more than twice the average healthcare spending of other high-income countries. And in fact, the U.S. spends more on healthcare per capita than any other country in the world. That's our data. So that's a lot of money.
Right.
But I think it's relative to what you get out of it. Because for that kind of money, we all should be healthy and living longer, and our infants should be healthy, and people shouldn't be suffering and getting sick. So let's have some stats on that, Ted. Hit us with some more stats, or hit us with some stats, right?
Right. So we'll talk about some of these different areas first where U.S. healthcare costs are out of control compared to other countries.
Other first world countries, so everyone's clear. Like countries that are like, I guess, have the same medium income that we do. Just what would consider
somewhat on par with the United States, because obviously we're not going to be looking at comparing us to a third world country.
Correct. Okay.
But the first one is administrative costs. So 8% of healthcare costs in the United States are administrative costs, which is more than double that of other high-income countries.
And it's funny, I was just telling you, when I saw the word administrative costs, I think of like the layers and the complexity of getting somebody through the system.
Right.
But other people that I mentioned this to were thinking about how much a CEO of your average, like, prestigious healthcare system makes.
Yeah.
It's all part of administrative costs.
It all is, yes.
All of anything aside from what a doctor or another practitioner, radiologist, whatever, is being paid for direct care is an administrative cost.
Well.
Right?
You have your lab costs. You have a lot of other.
But that wouldn't be administrative, would it?
No,
okay,
it wouldn't. That's the point. It's
It's just like kind of the periphery. It's really what it takes to keep the system running.
Right.
The very expensive system.
Exactly.
Okay.
Yeah. So I have a quote from the Annals of Internal Medicine from 2017, and it says that the gap in health administrative spending between the United States and Canada is large and widening, and it apparently reflects the inefficiencies of the U.S. private insurance-based multi-payer system. The prices that U.S. medical providers charge incorporate a hidden surcharge to cover their costly administrative burden. So this can be a big frustration for people that are paying for their health care, but when they have trouble getting somebody on the phone to talk to, it's something that's where the frustration gets, or having your doctor spend enough time with you, that those administrative costs.
Right, you think you would be more supportive.
Right.
You would think the more resources, body resources, the more efficient the system would be. And I like this part about hidden surcharges. So that would be why when people say, "Oh, I went to the emergency room, that Tylenol cost, I don't know, I'm making something up. The Tylenol was $120.
Right.
I can buy the Tylenol over the counter."
That mucus, what do they call it? A mucus containment system. The tissue cost $200.
Mucus containments. Yes, right. Because they have to kind of embed these costs. Because I guess when you look at an itemized bill then, and it's been a long time since I've seen one, thank God, but there isn't one for administrative costs.
Right.
It's kind of embedded in it.
Right.
And I think I forgot that that's what's happening.
Right. So even when you look at, say, the insurance company.
Okay.
So you said 11,000 whatever dollars per capita per person. So when the insurance companies are charging people for insurance, they have to make sure to keep that in mind because they have to pay that money out. So they need to take in $11,000 per person, plus they need to add their administrative costs on top of that so that they can actually administer that insurance.
Yes, another layer of complexity.
Right.
And I guess they use Canada because it's a first world country and it's close to us. Everything is pretty similar and they have a one payer system, meaning it's the government that pays. Pros and cons to that.
Yes, there's definitely a lot of inefficiencies there and a lot of problems.
Of course.
Yeah, when you look at...
That's another topic.
That definitely is another topic.
To compare socialized medicine versus a free market.
I mean, when I was in medical school, I remember patients, and I was in Arizona, and we would see patients that would do health holidays back, in the late 90s, early 2000s, coming to Arizona from Canada to get healthcare screenings and everything because they couldn't get them in Canada.
Oh my goodness, that's so interesting.
Yeah.
Where our people go to Canada to get prescriptions.
Right. So, I mean, none of it is perfect, but
none of it is perfect. And our goal is not here today to come up with to reinvent and come up with a perfect system, just to help people understand.
Right. Because if in Canada, say your doctor, say they suspect a brain tumor, it might be 6 months for you to get an MRI to say whether you really do have a brain tumor or not.
Oh, that would drive me crazy.
Yeah.
Most Americans would not put up with that.
Right.
Because we're used to having access.
Exactly.
Especially to things like
we
MRIs.
Always want instant access.
We do. And we have it for the large part, and that's costs.
Exactly.
Yeah, that stuff is not free. All right.
Yeah, so number 2 is prescription drug costs. So the U.S. is more than double in costs than other countries. In 2019, the latest year that we could get real information, the U.S. spent $1,126 per capita on prescription medicines compared to other countries that spent $552 on average.
Very interesting. So as a pharmacist, I wanted to weigh in on under prescription costs. There's also a cost of taking too many medications that may lead to interactions, adverse drug reactions, and there's some numbers there.
Right.
So we do take a lot of pills in this country. I think it's partly because we allow direct-to-consumer advertising for them and ask your doctor. So people are always asking their doctor for a pill, and there's this understanding that there's a pill for every problem. So the more medications, the more chance for something to go wrong because they don't just do the thing we want them to do. That is not their nature. Adverse drug reactions account for 30% of hospital admissions. Adverse drug reactions cost $30 billion annually. And this one's interesting. The expected average non-pharmacy related expenditure is about $14,000 for those with polypharmacy, and about $7,000 for those without polypharmacy. So the more drugs you take, the more you spend on non-drug-related problems caused by the drugs.
Right.
Be that interactions or adverse effects.
Well, of course.
So I guess my point is it's not just our drugs are more expensive. It's more nuanced, more complicated.
Right.
The more drugs, the more other things end up costing you. The more
You're going to have more
problems they
side
create.
effects that create other problems.
Which cost more money.
Of course.
That's
yeah.
it. Okay.
The next subject is elective surgery costs. So take a hip replacement. In 2019, the cost was over $40,000 in the United States, and other industrialized countries charge under $20,000. And in some countries like Poland, might be under $10,000 for the same hip replacement surgery that you pay $40,000 here in the United States.
I think I knew someone recently who went to another country to have hip replacement. I mean, I know people go to other countries to have plastic surgery.
Right.
But this is like a new phenomenon to go get their knees and hips replaced.
Right. Or especially when you're down south near the border going to Mexico to get healthcare, there's a whole boutique healthcare system right across the border for people,
Americans.
For
right?
Americans, yes.
That's a smart business plan. They're probably American doctors.
Oh, of course, yeah.
So it's like everything that you could want, but across the border.
Right.
I did not know of this. All right.
And so part of the reason that some of these areas of costs are so much higher is because here in the United States, we're effectively subsidizing the costs for other countries. So
as an example.
So most of the medical research and development happens here in the United States. We do most of the drug trials. We develop most of the different types of medical equipment. And so we end up having to pay those costs where other countries will put a cap on what you can charge for, say, a specific drug.
Interesting. And they probably put a cap on what you could charge for like an intervention. Like
Right.
Innovation, we are very innovative in this country. We have smart people, smart minds. We're kind of like given free rein to invent and create.
Right.
And technology is being top of the list, technology for healthcare. And those things cost money to create and invent.
Yeah.
And then the rest of the world gets to have that.
Right. And it sucks for us that we're
Yeah.
paying the extra cost and they're getting more benefits, but it's a fine line because
I think so too.
Because if we do too much to restrict those costs, then we're going to also restrict the innovations.
And that's really America. We love that. We love innovation.
Right.
So we're paying for the innovation. Yes. Just said that. All right. Doctor salaries. Kind of in line with that. The average PCP, primary care physician in the United States, is paid over $200,000 a year, whereas in most other countries, they're paid around $100,000 a year. So that's quite a discrepancy in salary.
Right. But more than any of the other healthcare costs, it's a lot harder to get under control here in the United States because
where would you even begin?
Right. Well, because say primary care doctors, because a specialist is a whole different ball of wax because they do make a lot more.
Of course.
But there's also a lot less of them.
True. And this was comparing your first access into the system as a primary care.
Right. And it's already where people don't want to go into primary care because they can't make as much money. So the more we try to restrict healthcare salaries for primary care doctors, we're going to get less and less doctors.
That's going to make that problem even worse.
Right.
That would not be good.
And that change isn't really one of the big costs of our healthcare system. Since 2000, medical costs have increased by 115%. Now, overall inflation for goods and services increased 78%. So definitely a big increase above what regular inflation is. But physician salaries have really not even kept up with inflation.
So I bet people don't even know that.
No. So another statistic I have for you is since 2001, physician reimbursement from Medicare is up 9% or up 0.4% per year, where overall economic inflation is up 78% or 2.5% per year. So you have Medicare costs, what Medicare will pay doctors over the last 20 years or so, 22 years, has increased 9%, where overall inflation has increased 78%.
That's a huge discrepancy.
So that shows that that's not where our changes in healthcare costs have come.
Right.
And so we have a graphic we'll put up here on the screen that shows the growth of physicians versus administrators in the healthcare system. And so you can see the black line is the percentage growth in U.S. healthcare spending per capita. The yellow mountain is the increase in administrative spending, and the small little, what is that, brown at the very bottom is the increase for physician costs.
That's amazing.
Since 1970 to 2009. And so, I mean, that's a huge discrepancy.
And especially when you see it.
Right. That's what makes that graphic so
It's so powerful. Wow. So there are areas, obviously not administrative areas, where the U.S. healthcare system is around the same cost as other countries.
Yes, so statistically speaking, the U.S. is about the same as other countries when it comes to utilization of medical services. So that would include doctor's visits, hospitalization, surgeries, and lab tests. So some areas might be a little higher, a little bit less, but there's always been a big thought with people that part of our healthcare spending going out of control is that there's an overutilization of services.
Yeah, which we really can't back that up.
No.
I'm not sure where that started. So it's kind of like saying, yes, people are doing all these unnecessary things.
Right.
They do unnecessary testing, access unnecessary technologies, get an MRI for the fun of it, or are always going to the emergency room, and that's just statistically doesn't pan out. That is not why that it's expensive.
No, I mean,
we use the system. We use our system about as much as other countries use their system.
Right.
The people. All right. Yeah, and I was thinking too that I think people don't use the system enough. So I would think it's maybe underuse of the system, and where sometimes people it's not for lack of trying. Like I had a friend who suddenly had her wrist was swollen, and as much as she tried to get into the doctor, she couldn't because they didn't have an appointment. So she was going here or there, and there was just a lot of things that were unnecessary. Probably did add up cost-wise because she couldn't access the one person she needed to access, which was her primary care, which goes back to your point. The last thing we want to do is somehow weaken that first point of entry.
Right. And I mean, this isn't including misusage, some other misuses of the system, like if people are uninsured and they can't see the medical doctor, or they just choose not to do their routine screenings and everything, but then go to the ER all the time, which is so much more expensive.
True. Yeah, so they should be using the primary doctors first and have that relationship and keep accessing the system from that point. All right, so, but there are places where the United States healthcare system really does, I guess I would say does a really good job.
Yeah, the U.S. healthcare system really shines with acute care.
Yes.
So if you want somebody to survive a heart attack or a stroke or an auto accident, things like that, we're second to none here in the United States for helping to preserve that life.
In a dire situation.
Yes.
Maybe we don't do a good job, like with prevention of the diseases that are costing us a lot of money, the chronic illnesses. But if you have an acute situation, it's good to be here
Yeah.
because we've got the best of the best.
And with that too, we talked about surgery costs, and our surgeons usually are the very best too, and people that have the means, the heads of state or people that are rich from other countries, typically do come here to get major surgeries.
It's true. They do, because this is where the best in the whole world
Right.
are for things like that. And I guess if we were, even though we said we weren't going to reimagine the healthcare system or come up with the most ideal system, I think knowing that we are really good in an emergency. So say you've had, I think a heart attack is a great example, and your life is saved. And it's a miracle, and it's absolutely amazing that happened, that you were able to get such great care so quickly. And then I think it would be great if like a naturopathic doctor or someone who really focuses on long-term disease prevention, that's when that person enters into your life.
Right.
When you're so grateful to have that life.
Yes.
And teaches you and works with you for prevention of future incidences.
Well, exactly. And so we would be able to then prevent these different illnesses. And like we've talked about before, 75% of our healthcare dollars are spent on chronic diseases.
Right.
If we take care of preventing these diseases or reducing the risk, because you can't totally prevent a disease when you take care of yourself, but you can greatly reduce your risks.
You can.
And we could be cutting our healthcare dollars in half as far as our spending, because we wouldn't have so many high-ticket healthcare issues that need to be taken care of.
Right. Good point. I mean, even if like, I don't know, I think of even if you're like I was in a car accident, like after that, I was just so grateful to be alive. And I thought to myself, well, I had to get well and fix everything that needed fixed. But I did double down and look and like, where have I slid in my prevention? Have I let things slide with my diet and my workout and my stress reduction? It was the perfect time to reevaluate.
Right.
Because I was in that glorious state of gratitude. Yeah. And corporate wellness programs. You had some really good stuff on that, the success of corporate wellness programs.
Yeah. So when we look at taking control of your healthcare and us reimagining the healthcare system where people do become their own advocates and take
Active
care
participants
of
and excited about getting well. Yeah.
So corporate wellness programs is where we can actually find some data to understand how those things would save us money.
Nice. And do you happen to know how long corporate wellness programs have been around?
I don't.
And wasn't there a time where you didn't get your quote unquote health insurance or whatever we're calling it? Your company didn't provide that for you.
Right.
And then there was a time in U.S. history where then corporate America, your company was in charge of your health care, and that went along just fine. And now it's like, holy cow, the price of an employee is not just their salary,
right,
but it's their health care and other benefits, but health care is a big one.
Yeah.
And so then they're like, well, we have to get involved in a different way and start bringing things into the company to help people stay well.
Yeah.
Just an interesting role that we've kind of taken for granted, because for me, it's always been that way.
Right. Yeah. I think the late 70s to early 80s is when the companies started using that benefit as a way to get good employees and retain good employees.
Oh, yes. It's a big perk.
Right.
Right.
Right. Unfortunately, they didn't realize the cost burden that was going to happen with such broad utilization of the system.
Yes. Right. And then we saw like things that, we're only going to cover somebody if they work this amount of hours. And so then they stopped hiring full-time people, and then there was part-time people, and all these things that we had to do to try to get around how expensive it was.
Right. Yeah, so we'll go back to the corporate wellness program.
Yeah.
So there's two different types of corporate corporate welfare programs. The first one is lifestyle management programs. So these are programs that are focused on those healthy living basics I always talk about.
Right.
So it's the healthy eating, the exercise, weight management, stress management, and quitting smoking. And that can all be really beneficial. But unfortunately, when you're doing a short-term study on this, you can't necessarily see the long-term monetary benefits. So if you're doing a
You have to go for decades.
1 year or 2 year study, you're not going to see those seeds you planted for a couple of decades.
True. So the benefit is we do see a little bit of a benefit. So they're measuring some things, but your point is the benefits are even greater. Having these corporate wellness programs where your company helps you lose weight, they give you, I don't know, gym memberships and trackers, and they maybe reward you for weight loss, or they have contests, things like that. That's what we're talking about, right?
Yeah.
Or they bring in someone to teach you stress management, has maybe greater effects down the road than they're even able to measure.
Right. So that part, like I said, isn't really, we won't go into the numbers because it's not really truly as impactful as it really would be.
Right.
But the disease management programs are where we really see some huge cost changes.
Okay.
So this would be people that this is in line with the conventional medicine prevention programs, which is early detection.
Okay. Oh, so companies, yes, of course they are. They're getting involved in early detection. They're bringing someone in to measure these things in their employees.
Right. So whether you have a risk for heart disease, you've already started having high cholesterol or high blood pressure, or you're starting to see high blood sugars and diabetes, or people that are smokers and are at a greater risk for emphysema, you can do a lot more in these kind of programs, these corporate, wellness programs, to see huge cost benefits, because you're keeping people out of the hospital for heart attacks and strokes, amputations, pneumonia. The Harvard Business Review highlighted a study that showed a $1,421 per participant in healthcare savings when they focus on these types of disease management programs.
So that's why you see a lot of that, because they have access to that data. That's where we're going to get the most savings, the most bang for our buck. So we're going to bring these specific disease prevention programs into our company. We're going to measure people for heart disease and measure them for pre-diabetes, and maybe measure their lung capacity and things like that.
Right.
Yeah, very cool.
Yeah.
I work for a small company now, so I don't have any of that, but the company before, that's what we would do. We would get a screening, and if your numbers were good, then you paid less for your health care premiums. You were in this other bracket because they were saving even more.
Right. Yeah.
Because they have all that data.
Yeah.
That's very cool that we have that in America.
Right. Well, yeah.
Yes, I love that. All right, so here we are, the consumer of healthcare. We're Americans. We spend this much money collectively on healthcare. What are we getting out of it? We like to think that if we're spending the most, then we get the most out of it. We should be the happiest and the healthiest.
Right.
And unfortunately, what the data shows is not quite that rosy picture.
Right. So when we look at healthcare spending per person and per share of GDP, gross domestic product, we are always way higher than all other high-income countries. Yet we're the only one of those countries, high-income countries, that don't have a universal health coverage.
Of some form.
And we're not, and this isn't our point of pointing that out to say that that's better, because we've already talked about some different things where some of those programs aren't the best. They're in all ways, none of these healthcare programs.
There's no perfect system.
Exactly.
Right.
And our country would learn, even if we did have full universal coverage, they would figure out how to ruin it.
Yeah.
But the U.S. has
the lowest
life expectancy at birth.
That is shocking to me.
It is.
My goodness.
And it also makes me question and wonder and look at these studies to understand how those numbers really are.
How they're gathered?
They're gathered.
Yeah, where this data comes from?
Because maybe it's underreported in other countries to make them look better. They don't want to pay for it, so it's not found as easily.
That could very well be.
So we don't know.
We don't know.
But we have the highest death rate for avoidable or treatable conditions.
That I kind of get.
Right.
Especially if it's chronic illnesses that are causing most of the death and suffering.
Right. But when we have better doctors, they might be finding more too.
Oh, very true. So that's skewing the data.
It could be skewing the data.
Okay.
And I'm not a conspiracy theorist to say that, but it's things that we have to think about.
Absolutely.
We also have the highest maternal and infant mortality and among the highest in suicide rates.
Yeah, the suicide is interesting because you would think that living in a country with so much wealth and access that you would be happier, but that's a whole other topic.
Yes. Yes, we also have a lot more pressures put on us.
Yes, absolutely. Mm-hmm. All right, so no easy answers to fix this. But again, when I look at things like this and take a step back and look at the data, I think it's just more motivation to, try to keep myself well, because if those costs are only going to rise.
Right.
Like I used to tell my kids when they were little, this is why we go see a kind of doctor that your friends don't go to, and this is why we eat the way we eat, and this is why we do what we do, is because when you guys get to be in your 20s, you're probably going to be the only ones of your peers who aren't on a lot of medication, and healthcare costs are going to be very expensive for you. And I was right.
Yeah.
They are. They're very expensive for my kids compared to like when I started. When I was their age, things were so much less expensive. So I said, if you're healthier, you're not going to need the expensive system.
Right.
This is what I thought, and I was right.
Yeah, and so with that, it depends on where you are in the healthcare system too. If you have a good employer-based program, this isn't nearly as much of a concern, although most of the employer systems are still having to pay more and more into your healthcare and having higher deductibles.
Right. This is what I'm seeing in my patients. They got to pass it. My husband likes to say the house always wins.
Right.
Like they're going to pass it on.
Yeah.
So ultimately, you're paying.
Right.
Right.
Right. But with those higher deductibles, if you are taking care of yourself and you don't have to use the system as much, you're going to save money. And especially if you are, if your company doesn't pay for your health insurance, say you're a small business owner or somebody who doesn't have healthcare paid for.
Right.
If you just keep a high deductible plan for emergencies.
That's what I have.
Same here. If we have something big happens with our family, we'll be covered.
Exactly.
Otherwise, we pay for the rest out of pocket, and
that's what I do.
And we're always
traditional, non-traditional. Yep.
So really, when we look at it, if people are to take care of their own health and take responsibility for their health, they're going to use less healthcare dollars, and that in itself will save money for you personally. I mean, whether it is from a employer-based program that you still have a higher deductible, or you're paying on your own for healthcare, if you're taking care of yourself and you don't need to utilize the system as much. And that's not to say that you shouldn't utilize the system, because we've talked about how you need to be doing your routine screenings and all those things.
Correct.
But if you are taking care of yourself, then hopefully those routine screenings will be all the further you need to go. You won't have to go for more invasive therapies and surgeries and whatnot.
By and large, this is very true. And the point really, I think, of us even taking this on is that so people have an understanding. And anytime you have an understanding, you could always use it to make yourself better. You could just choose to take a defeatist attitude. Oh, it's so expensive, and the CEO of this company or that healthcare company or this hospital makes so much money. It's so unfair, and that's why I have to spend so much. Or you can just say, all right, this is where we are collectively as a country. What can I do for myself to keep myself healthy and well, and also to reduce my own spending on healthcare? I mean, that's our whole point. That's why why we're talking about this.
Right. That's the only thing you have control over.
That's right. Control what you can. Understand what you can't.
Right.
But control what you can.
Exactly.
So in summary, we spend a lot on admin. since we don't have a single payer and we have a very complicated system, lots of layers, lots of money spent on administrative costs. We spend a lot on drugs, prescription medications, and the more you take of those, the more costs are incurred due to the drug-drug interactions, adverse drug reactions, and all those other costs that come with it. Innovation has a price, such as with elective surgeries, which cost more. I think that's probably my biggest takeaway is the price of innovation. And would I be willing to live in a country with less innovation? I love innovation.
Right. Well, and it comes down to if we don't do the innovating, who will?
Yeah. And
I mean, it's not the matter of
someone
if
else
we
will
don't
do
do it, then somebody else will do it. Nobody else is there to pick up the pieces.
Got you. Love that. And we do have better outcomes in some areas, like accidents and heart attacks, which goes to the skill of the practitioners and the availability of everything that is needed to save someone's life. So there you have it. Thanks for listening. We so appreciate you. See you next time.
Thank you for joining us for this podcast. Mary and Dr. Ted want to remind you to use the internet wisely and to always be sure to consult with your medical provider with any questions or concerns that you may have as you work towards your wellness goals. We look forward to sharing more content with you soon. Thanks for listening.